Let me teach you a couple of ways that you can immediately eliminate wrong answer choices on your nursing exam. This test taking strategy has to do with communication because remember, the way you say things absolutely matters. Number one, don't pass the buck. When you are answering communication questions, never choose the option where the nurse pushes responsibility onto someone else. On exams, you address patient concern first. You don't hand it off unless something actually requires escalation. This is where students can get confused because not passing the buck doesn't mean that you never call the provider. You would call the provider after you've done what your scope of practice allows. Calling the provider would be appropriate for things like critical lab values or sudden deterioration in your patient. If your patient is in need of a new order or a new plan of treatment, then calling the provider is a safe answer. Number two, avoid why questions. Just immediately eliminate any answer choice that starts with why. Why questions come across as judgmental and make your patients defensive. Something like, why did you stop taking your medication? You don't want to do that. Which brings me to my next point. Number three, use open-ended questions. When your goal is assessment or clarification, make sure you're choosing open-ended responses. For example, don't say, are you anxious? That's a yes or no answer. Instead, say something like, what are you feeling right now? Number four, never blame or shame the patient. Any answer that blames or lectures or shames the patient is going to be wrong. Something like, you should have called sooner. A better choice would be something like, thank you for telling me. Let's talk about what's been happening. For a lot of these communication questions, it may not feel like you'd actually say them in a real life setting, but for NCLEX purposes and for test taking purposes, make sure that you're saying things the right way.